Now, I know a lot of parents get concerned about possible side effects of asthma medication. What should parents know about those side effects?
Yeah, I think particular concern has been with the inhaled glucocorticoids that I just mentioned that are used for persistent asthma. One of the biggest concerns is growth deceleration in children. Um, the studies have shown that, that over a long-term period, you don't really need to worry about any kind of growth suppression or anything like that. So in general, using these inhaled steroids are pretty safe. I think it's more concerning when you have a patient that has poorly controlled asthma and they're not on a maintenance medication such as an inhaled steroid. Those are the patients that end up getting, oral steroids, which have a lot more side effects than doing it inhaled. So I prefer the inhaled steroids to the oral when you can.
Now, besides asthma medication, are there everyday things that parents can do to help manage their child's asthma?
Yeah, and little things like, I think that one of the most important things is identifying and avoiding triggers to your asthma. So many patients with asthma also have allergies, and so if you can find out what your triggers are, whether it be, dust mites or animal dander or mold, things like that, if you can identify what your triggers are, then taking the steps to avoid your triggers is going to help decrease your symptoms of asthma.
Do you have any asthma management tips for parents today? Some doctors um, have suggested to us things like washing hair when kids come inside, things like that. Anything that you've seen that's been helpful?
Yeah, absolutely. Especially those things are going to be more helpful in patients that definitely have allergies. For example, if you have a patient that you have identified that has a dust mite allergy, then that decreasing your exposure to dust mites would help decrease your symptoms of asthma. One way to decrease your exposure to dust mites would be to get dust mite covers for your pillows and mattresses, things like that. If you've identified, that pollen is a trigger for your asthma, then decreasing your exposure, decreasing the amount of time outside so that you can decrease your exposure to pollen, because that can, in effect, also improve your asthma control.